My name is Malcolm Finlay. I'm a consultant cardiologist and electrophysiologist. I work at Bart's Heart Centre, the London Bridge Hospital, and at 1 Welbeck Street. So I've always been interested in science. I love engineering as well as biology. And when I was doing my A-levels, there was just this question like, what's the next big thing? And turns out, I loved electrics and the computers and so on. And cardiac electrophysiology has it all for me. So when I went from school, I got a place in university and to study medicine, really not knowing if I was actually going to end up being a doctor, but found I loved it. And I loved dealing with people and with patients. And so, that's what I do. Yeah. So I grew up mainly in Cardiff, but I also spent 5 years in Glasgow as a child. And funnily enough, I spent a year as a tiny boy in Florida in the United States. So I moved around a bit as a kid. So definitely the best thing about my job is being able to really treat someone and provide a great service and have them feel better at the end of the day. There's nothing else, I think, quite like that privilege of being able to being in a position to offer someone a procedure that goes them from feeling unwell and something totally interrupting their life to being fully back to normal life again. And that's a privilege to be involved in these people's care, and it's a great thing, a great feeling to being able to offer that service. Okay, what do patients value most about me? I have a sense of humor. I treat patients not actually as patients, but I think about them as people, right? I don't want to treat people as I wouldn't want to be treated. And I think that comes across in my relationships with patients, both in the way that I really prioritize their safety, but also prioritizing their best interests over perhaps the medical dictum. So I really try to make things best for the patients. I think people appreciate it. And do I have any mantra or catchphrase that I use my way? I mean, my colleagues would say, where's the checklist? Because as you may or may not know, I fly aircraft as a hobby, and from that I've taken this idea of using checklists for all sorts of things, and that's something that means that I don't forget to do something which is routine and ordinary, but and in the aircraft that might be putting down the undercarriage when we're coming to land. That's important. In the patient, it may be giving heparin during a air fibrillation procedure. That's also important. So I say, where's the checklist?